Hello everyone, and thank you for taking the time out today to hear about Volpara Health Technologies. We are a company focused very much on saving families from cancer. Volpara is or VHT is a software as a service company based here in New Zealand, in Wellington. We very much sell globally, and our technology is based off research that I did in the University of Oxford back in the 1990s. Our focus on cancer is breast cancer. 600,000 women a year die from breast cancer. And it's our mission to reduce that mortality by applying AI to breast images for a range of clinical decision support tools and practice management software. And we'll give you a little demo of some of that in a minute. This is a big opportunity. 92 million women a year are screened around the world. Half of those are in the US. We believe we can get around $10 ARPU for each woman to give you an idea of the overall target size for the market. We have first mover advantage. We now cover about 1 in 4 screenings in the US, which is our primary market. We're up to just under 20 million of annual recurring revenue at the end of Q2, which is the end of September for us. And we get excellent gross margins showing that the underlying business is very scalable. We are very strong in terms of finances, and we've been very resilient over this period with COVID. If you look on the left-hand side there, you'll see a little graph with blue and red bars. The red bars show that during the big lockdown period in the US, breast cancer screening effectively stopped. But what we found during that period was that customers kept paying us because they fully expected to catch up those women later on. Plus, the world soon realized that you can delay breast cancer screening or any screening, but if you do that, it's at the cost of late-stage cancers, and people do not want that. So screening now very much up and running again, and actually doing many more images than before the lockdown in the US. So it's a very resilient industry. We've proven to be a very resilient company based around our history of being based in Wellington with earthquakes. So we've always been very remote and cloud-based. And we had a very resilient business model, which is based around subscription fees paid a yearly upfront. During the first wave of COVID, we did raise money. We raised it for 2 reasons. 1, strengthen the balance book, and 2, to be ready for any M&A, which might arise as companies got into trouble during the COVID period. And I think fair to say, I think we're starting to see increasing signs now of activity around the area as companies realise the full extent of COVID, and valuations and so on become much more realistic. Let's tell you then a little bit about our software. So this is a Volpara Ideal Clinic. So the woman walks in the clinic at the top left. She is handed a tablet. Into that tablet, she enters all her information such as age, BMI, family history, and so on of breast cancer. She then has her x-rays done. Volpara Product Live pops up and says, those are good x-rays, you can send this woman home, or they're bad x-rays, let's retake that one whilst the woman is here. Those high quality images then flow over to the radiologist, who's now got excellent quality images from which to try and diagnose breast cancer. The radiologist sees the Volpara scorecard, which tells her the risk of the woman in terms of her breast density, in terms of her lifetime risk. So she can make judgment calls on what to do with that woman, such as should I recommend MRI, should I recommend ultrasound, and so on. And then all that information and the radiologist's decision all flows into the patient letter, which our software, Aspen Breast, writes effectively and automates and sends it back out to the woman. So that kind of top line is our clinical decision support network and all support tools. And you'll notice on the right-hand side how people are starting to use that information. Triage to ultrasound, for example, if you've got very high breast density, which means high risk of missing cancer. So we work with GE quite closely on reselling some of our software. But more recently as well, we've started to sell and starting to gatekeeper people over into the genetics world with a partnership with Ambry Genetics. That is just over 6 months old now, and it's starting to look very interesting in terms of ARPU. So we're all good on that. The data then from all these tools, these AI tools, all flow up into the cloud, where Aspen Breast and Volpara Enterprise provide patient tracking and enterprise-wide quality control. So the enterprise software in particular can tell you all your X-ray machines, what they're all doing. It can tell you about all the technologies which are taking the images. Are they doing a good job? Are they doing a bad job? And so on, and can help you spot productivity issues as well. We do have competition in space, but they all tend to have one or two bits of this puzzle and not the whole integrated breast platform, which gives you a very smooth integrated workflow. Integrated workflows in a smooth fashion are critical to clinical acceptance of AI. Let me tell you about one of our new initiatives. In July, August time, we decided that the current business model of effectively going to trade shows and then getting leads and then following them up by on-site visits was gone with COVID. So we switched business models and we started to think about the women themselves rather than our customers directly. And we started to think, well, how can we help these women? And then we come up with several ideas, and this is the first one. This is where instead of just a letter going out to the woman generated by Aspen Breast with plain text in it, we're actually starting to put the actual images in there. So the interesting thing here is Volpara has got access to the images and the patient letter. So we're in a very strong position to actually kind of do this unique combination. And as they say, an image can speak 1,000 words. So the use of these images to explain these critical breast healthcare concepts like breast density has been very well received so far. And you're going to see more and more of this initiative over the next year. Breast density is a big topic at the FDA. The FDA did about 18 months ago say at some point soon that they're going to come out and mandate all women should be told their breast density. That's been delayed somewhat due to coronavirus and the US elections. And we're just waiting for an update now, which we'll tell all shareholders about as soon as we hear anything. But obviously there's a bit of a mist at the moment over Washington, DC, but things I'm sure will clear up in the new year, if not earlier. Let's just talk about the market a bit. 39 million women are screened each year in the US. We cover up 10 million of those. We have a great relationship with GE and increasingly now Fuji as well. And we have some great sites, MD Anderson and MSK, who have been big users of Volpara for the last few years. We are not just a US company though, although it's probably about 90% of our revenue is from the US. Around 39 countries around the world use Volpara. We're increasingly being used across Australia and across New Zealand. We've had some outstanding papers come out, like the DENT study, which is a 10-year randomized controlled study showing the real benefits of personalized screening using our software. And that's generating huge interest, not just in the private setting, but also in the public setting around the world. And yeah, we're looking forward to start to crack some of that public screening world. We've got one deal in the bag already, and we're just looking now for the second one. They've all been delayed because of COVID, but as they clear up, we'll be announcing them. So last week we announced our half-year results. I thought we'd just give you a highlight. Accounting revenue was up 38%. The ARPU has risen 30% over the year, which is great. The mix of capital to SaaS has really gone much more towards SaaS. And as you see there as well, our market share has remained pretty constant, around 25, 26, 27%. We are focusing a lot at the moment because of COVID on the install base. We're trying to get all our customers, especially legacy ones on capital contracts, moving over to SaaS. As we do that, as we put pressure on these sites and as they feel cost pressure as well due to COVID, we're seeing the percentage of women stay fairly flat or even decrease a little bit, but ARR and ARPU continues to go up. Most of those sites are very low ARPU, so we're effectively switching them out for higher ARPU. And when we move them from capital to SaaS, we typically get to 200 to 300% uplift in that. So look, summary slide. People always talk to us about COVID. We're a resilient industry, we're a resilient company, and so on. We have taken a decision to refocus much more this year, US, Australia, and New Zealand, although we keep a footprint in Europe and Asia. We continue to innovate. We continue to build the team here in Wellington and elsewhere around the world to bring forward new AI and to use the huge data set we've got in the cloud now for new products. We're very much a SaaS company, and those contracts have been remarkably good during this weird period of ours. And yeah, we're changing the way we do business away from trade shows to digital marketing. away from site visits to site visits to remote sales and so on. And also we're partnering to scale this year as well, put a lot more energy into GE, Fuji, Ambry Genetics and so on. And yeah, finally here, yeah, we're in a very strong position for the financial year because of the cash we raised earlier. And as I said earlier as well, we're starting to see opportunities arise around M&A as companies around the world realise how tough the market is at the moment around COVID. So yeah, look, we remain positive. We've had a quite remarkable half year, which we announced last week. Second half is very unpredictable. Obviously, coronavirus is pretty rampant now across the US, and you've got this US political vacuum. But we are dead set on coming out of this financial year, which for us runs to April, in a very strong position and very geared for growth as coronavirus starts to die down with those vaccines. With that, thank you very much, and it's open for questions.